how can I identify or how can one identify their transferable skills and match them to roles outside of clinical practice?
Yeah, so I think this is a really nice question because we all talk about transferable skills, and I think on the surface we're like, yeah, there's so many transferable skills from medicine. There's lots of things that we do as a doctor that we can do in other industries. Or like, oh, if I was doing their job, I'd do it much better than them, right? But the tricky part becomes actually getting clear on what those skills are. And there are some skills that we don't really see as obviously as somebody on the other side might see them, right? But I think the third layer to that would be to really align it with what you're trying to achieve. So which of those transferable skills align the most with what you're trying to achieve? Essentially, there's things that matter to medicine, and there's some things that don't matter as generally. Here's what medicine guarantees that you'll achieve and the skills that you'll be really good at. It's clinical decision making, technical proficiency, managing a crisis, adhering to protocols, which can often be quite complex and then intertwined with ethics and legal principles, managing a really busy time and workload. But what it doesn't often give enough credit to, and what non clinical jobs will credit a lot more, are things like strategic thinking and business acumen. And now, this is sort of an example of, say you're sitting in an outpatient department, you're sitting in an OPD, and you've seen a patient go through the department, and you're like, oh, this shouldn't struggle so much. The whole thing can be a lot more efficient, and that can save time, that can make more money, and that's really big picture strategic thinking. And if you take that to your hospital, not they won't bother as much because the things that they're tracking might be very different from the things that other businesses are tracking. But those kind of skills are still very transferable and hugely valuable. There's skills around influence and negotiation, and we don't think about this much as a doctor, but every day you talk to a patient, you are negotiating with them, you are selling a treatment to them. And I don't mean selling purely in the terms of like making money kind of selling. I mean, you are proposing a solution and trying to align it with the problem that they came in with. Every time you make a referral to a specialist, you are negotiating. Every time you request a scan or an investigation, you have this ability to make an ask and justify it really well, and those are hugely transferable skills again in non-clinical settings. Projects and ops management, and now as doctors we might feel like, oh, unless we've done a project, we haven't done ops project management. But literally every patient is a project in a way, and if you've managed a patient, you've got the skills to be able to manage a project. And then there's things around branding and marketing. Again, this is about how you show up in the market, in the clinical setting, how you show up in the ward, the words you use, how people perceive you. All of that is also skills in branding and marketing. And stakeholder engagement and networking are fancy corporate terms for, did you keep your boss in the loop? Have you informed the relevant specialties before this patient's gone into theater? And have you shown your work? Have you presented at a conference? Have you know, let people know what your real value is? And that's networking. So yeah, just a quick little slide to talk about transferable skills. Um, and and actually, for me, what that meant was, before I had figured out these transferable skills, I was just really stuck, still figuring out who I am, which specialty I want to go to, what's the next right job, who's going to hire me, like what do they see in me, who wants a doctor, right? That's the question we ask. Like, which companies are looking for a doctor, not what problem for the company can I solve. And lastly, I'm just a doctor. We just kind of stay stuck with that. Whereas after having this new lens to it, I realize that what I do is I help people get clarity when it matters the most. Like in an emergency department, patients come to me undifferentiated. Their family members rely on me for making sense of the really complicated situation. And that's something I do there. And if I take that into another setting, which I do now as a executive coach, I can provide that same degree of value. And I realized that I look at systems in a very different way from some other people. And there's people who like details, there's people who like big picture thinking, there's people who like the people element to it, there's people who like the product and tech element to it. And so everyone's got their own lens of looking at the world. And I believed, and I realized through my quality improvement work, that I could improve systems through using a methodology. And if I can do that in healthcare, I can do that elsewhere too. So yeah, that's, I think when it comes to transferable skills, ask yourself, but also ask the people around you, how are you already creating value? How are you already solving problems that would be valuable outside?